Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024. This research investigates the effect of a medication called ε-aminocaproic acid on dogs suffering from severe thrombocytopenia. Thrombocytopenia, a common condition encountered in veterinary hospitals, is characterized by a dangerously low number of platelets in the bloodstream. Platelets are essential blood components that play a critical role in forming blood clots and preventing excessive bleeding. When platelet counts are severely reduced, dogs are at risk of spontaneous hemorrhage, which can lead to significant complications and increased healthcare costs due to the need for blood product administration. Currently, the primary treatment to protect against spontaneous bleeding in dogs with low platelet counts is the administration of platelets through blood transfusions. However, this study explores whether an alternative treatment, ε-aminocaproic acid, could help these patients by reducing their need for blood transfusions and improving their overall outcome. ε-aminocaproic acid, along with another medication called tranexamic acid, belongs to a class of drugs known as antifibrinolytic agents. These medications work by inhibiting the breakdown of blood clots. They achieve this by binding to specific sites on a protein called plasminogen, which prevents plasmin, an enzyme responsible for dissolving clots, from attaching to fibrin, the main structural component of a blood clot. In human medicine, antifibrinolytics are used in various situations involving excessive bleeding, such as during acute trauma, after childbirth, and during surgery. In veterinary medicine, there has been growing interest in using antifibrinolytics as an additional treatment for bleeding from various causes, including bleeding associated with low platelet counts. Several factors contribute to this interest, including their relatively low cost, a perceived low risk of adverse effects, and the limited availability of rapid tests to detect excessive clot breakdown, also known as hyperfibrinolysis. It has been speculated that in patients with low platelet counts, antifibrinolytics might help to stabilize the fragile blood clots that do form, thereby reducing further hemorrhage. Some studies in humans with immune thrombocytopenia, a condition where the body's immune system destroys its own platelets, and in patients with low platelet counts due to blood cancers, have suggested that antifibrinolytics might reduce clinical signs of bleeding and the need for platelet transfusions. However, the evidence in this area has been considered limited. A small study in veterinary medicine investigating the use of tranexamic acid in 4 dogs with immune thrombocytopenia found no apparent clinical benefit compared to a control group of 6 dogs. To gain a more comprehensive understanding, researchers in this study aimed to determine if treatment with ε-aminocaproic acid would decrease the requirement for blood transfusions and improve the outcome in dogs with severe thrombocytopenia. Additionally, they sought to investigate whether these dogs showed evidence of excessive clot breakdown and how the administration of ε-aminocaproic acid affected certain parameters measured by a specialized blood test called thromboelastography. Thromboelastography is a test that assesses the overall clotting ability of blood. In this study, they used a specific type of thromboelastography called rapid thromboelastography, and also a modified version where tissue plasminogen activator, a substance that promotes clot breakdown, was added to the blood sample. This modified test, called tissue plasminogen activator spiked rapid thromboelastography, can help detect a tendency towards excessive clot breakdown that might not be obvious with standard tests. To the researchers' knowledge, the potential for excessive clot breakdown in dogs with low platelet counts had not been thoroughly investigated before this study. The researchers hypothesized that treating dogs with severe thrombocytopenia with ε-aminocaproic acid would lead to less spontaneous bleeding and a reduced need for blood transfusions. Their primary goals were to determine if preventative treatment with ε-aminocaproic acid decreased the frequency and severity of spontaneous hemorrhage, reduced the need for blood transfusions, and improved the survival rate of dogs with severe thrombocytopenia until they were discharged from the hospital. A secondary goal was to determine if dogs with low platelet counts showed thromboelastographic evidence of excessive clot breakdown, and to evaluate how treatment with ε-aminocaproic acid affected the parameters measured by the tissue plasminogen activator spiked rapid thromboelastography test. Now, let's move on to the findings of this research. The study involved 27 dogs with severe thrombocytopenia that received ε-aminocaproic acid as part of a single-arm clinical trial. To compare the outcomes, the researchers also collected data from the hospital records of 33 additional dogs with severe thrombocytopenia that were treated in the past and served as a historical control group. The majority of the dogs in both groups, approximately 90%, were diagnosed with primary immune thrombocytopenia. The remaining dogs had various other underlying conditions that led to low platelet counts, such as pancytopenia, suspected tick-borne diseases, suspected lymphoma, and acute leukemia. The treatments administered for the underlying causes of the thrombocytopenia varied between individual dogs in both the ε-aminocaproic acid group and the historical control group, involving different combinations of immunosuppressive medications and other supportive therapies. Notably, none of the dogs in the ε-aminocaproic acid group received intravenous immunoglobulin, while 9 dogs in the historical control group did. However, when the researchers reanalyzed their data excluding the historical control dogs that received intravenous immunoglobulin, the overall results remained the same. Similarly, when the analysis was limited to only dogs with primary immune thrombocytopenia, no significant differences in the outcomes were observed. The researchers monitored the dog's red blood cell volume and total protein levels, and they recorded any observed episodes of bleeding, such as nosebleeds, dark tarry stool, or blood in the urine. A decrease of more than 10% in either red blood cell volume or total protein was also considered a bleeding event. However, because detailed records of observed bleeding were not consistently available for the dogs in the ε-aminocaproic acid group, the researchers decided to exclude observed bleeding events from their main analysis, assuming the same issue existed in the historical control group. All blood product transfusions, including packed red blood cells and fresh whole blood, were carefully documented for both groups. The amount of blood product administered per transfusion was similar in both groups. The study found that there was no significant difference in the number of blood transfusions required per dog between the group that received ε-aminocaproic acid and the historical control group. The median number of transfusions per dog was approximately 1 in both groups. Similarly, there was no significant difference in the proportion of dogs in each group that received a transfusion of fresh whole blood. Although a slightly larger percentage of dogs in the ε-aminocaproic acid group did not require any blood products at all compared to the historical control group, this difference was not statistically significant. Furthermore, the frequency of bleeding events, defined by the acute decreases in red blood cell volume or total protein, was also not significantly different between the two groups. Regarding the duration of hospitalization, the median number of days from admission to the end of the study was 4 days for the historical control group and 4.5 days for the ε-aminocaproic acid group. This difference was not statistically significant. In terms of outcome, 30 out of 33 dogs in the historical control group survived to discharge. In the ε-aminocaproic acid group, 17 out of 22 dogs survived to discharge. The fatality rate was not significantly different between the two groups. Statistical analysis also showed no significant difference in the survival time between the two groups. The researchers also performed thromboelastography tests on the dogs in the ε-aminocaproic acid group before and during the administration of the medication. They measured several parameters, including the maximum amplitude, which reflects the strength of the blood clot. They found a statistically significant increase in the maximum amplitude on both the rapid thromboelastography and the tissue plasminogen activator spiked rapid thromboelastography tests after the administration of ε-aminocaproic acid. This indicates that the treatment with ε-aminocaproic acid did lead to an increase in clot strength. However, none of the other thromboelastography parameters measured showed a significant difference after treatment. Only one dog in the study showed mild evidence of excessive clot breakdown on the tissue plasminogen activator spiked rapid thromboelastography test at the beginning of the study, and this resolved after treatment with ε-aminocaproic acid. This particular dog did not have anemia at the start of the study and did not require any blood transfusions. The researchers found a strong positive correlation between the maximum amplitude values measured before and after the administration of ε-aminocaproic acid for both types of thromboelastography tests. This suggests that dogs with a lower initial clot strength tended to have a lower clot strength after treatment, and vice versa, although the strength generally increased. Interestingly, they found only a weak correlation between the platelet count and the maximum amplitude measured by either thromboelastography test, both before and after treatment. Now, let's discuss the implications of these findings. The study's most notable finding was that while prophylactic treatment with ε-aminocaproic acid significantly increased the strength of blood clots in dogs with severe thrombocytopenia, as demonstrated by the thromboelastography testing, this increase did not translate into a clinically significant effect on important outcomes, such as the duration of hospitalization, the mortality rate, the occurrence of acute drops in red blood cell volume or total protein, or the number of blood transfusions required. This research adds to the limited body of evidence on the use of antifibrinolytics in dogs with low platelet counts. The findings align with a small previous study that found no clinical benefit of tranexamic acid in dogs with immune thrombocytopenia. While a retrospective study on the use of tranexamic acid in dogs with various bleeding disorders suggested potential benefits, it did not specifically analyze the subgroup of dogs with thrombocytopenia, The majority of dogs in this study were diagnosed with primary immune thrombocytopenia. Many studies investigating antifibrinolytic use in humans with low platelet counts have focused on patients with blood cancers rather than immune thrombocytopenia. A comprehensive review in 2016 concluded that there was insufficient high-quality evidence to support the routine use of antifibrinolytics in thrombocytopenic patients with blood cancers. Since then, a large randomized controlled trial in humans with blood cancers did not find a significant reduction in transfusions, platelet administration, or bleeding events with prophylactic tranexamic acid. There are only a few reports describing the use of antifibrinolytics in humans with immune thrombocytopenia and active bleeding. Some of these reports suggest that antifibrinolytics might help control bleeding and reduce the need for platelet products in these specific situations. However, this study focused on the prophylactic use of ε-aminocaproic acid, meaning it was given to prevent bleeding rather than to treat ongoing hemorrhage. Based on the current lack of strong evidence, human medicine guidelines generally do not recommend the routine use of ε-aminocaproic acid or tranexamic acid for immune thrombocytopenia, although they may be considered in patients with active bleeding. Ε-aminocaproic acid appears to be generally well tolerated in dogs. Previous research using lower doses reported only mild gastrointestinal side effects in a small number of dogs. In this study, higher doses were used based on recent evidence suggesting that increased doses are needed to achieve more effective inhibition of clot breakdown in dogs. While one dog in this study developed regurgitation and the medication was stopped as a precaution, it was unclear if this was related to the ε-aminocaproic acid or the dog's underlying condition. Notably, 2 dogs in the study developed blood clots in their urinary bladders leading to urethral obstruction, and the ε-aminocaproic acid treatment was discontinued in these cases. While a similar complication has been reported in a dog with immune thrombocytopenia previously, the contribution of ε-aminocaproic acid to this issue remains unknown. However, given that antifibrinolytics work to stabilize blood clots, caution may be warranted when using these medications in dogs with significant bleeding in the urinary tract. One of the reasons for considering antifibrinolytics in patients with low platelet counts is the hypothesis that there might be an imbalance in the process of clot formation and breakdown, with a potential for increased clot breakdown due to a lack of substances normally released by platelets that inhibit this process. Additionally, dogs with severe hemorrhage might develop a more widespread condition of excessive clot breakdown. To investigate this, the researchers used the tissue plasminogen activator spiked rapid thromboelastography test. They found that only one dog showed mild evidence of excessive clot breakdown at the beginning of the study, and this resolved after treatment with ε-aminocaproic acid. This finding did not appear to be clinically significant in this particular dog. The generally normal clot breakdown profiles observed in these dogs might explain why the prophylactic treatment with ε-aminocaproic acid did not show a significant clinical benefit. These findings are similar to those in human studies of thrombocytopenic patients with blood cancers, where excessive clot breakdown was also not commonly found. This suggests that systemic excessive clot breakdown may not be a primary factor contributing to hemorrhage in patients with low platelet counts. The significant increase in clot strength observed on the thromboelastography tests after ε-aminocaproic acid administration was not linked to an increase in platelet count. Although fibrinogen levels, another important clotting protein, were not consistently measured, a decrease in red blood cell volume could potentially increase clot strength, as suggested by previous studies. In this study, the red blood cell volume was slightly lower after treatment, but this difference was not statistically significant, and a recent study did not confirm a strong influence of red blood cell volume on clot strength in this type of testing. While the increase in clot strength observed with the tissue plasminogen activator spiked rapid thromboelastography test aligns with a previous report on the effect of ε-aminocaproic acid in dogs, the reason for the mild increase in the standard rapid thromboelastography test is less clear. It is possible that the clot strength increased naturally over time in some dogs due to the treatment with corticosteroids for their underlying thrombocytopenia, independent of the ε-aminocaproic acid. Another possibility is that a low level of clot breakdown activity was present, reducing clot strength without causing significant changes in other measures of clot breakdown, and this was inhibited by the ε-aminocaproic acid. Regardless of the underlying mechanism, this increase in clot strength did not result in a noticeable clinical improvement in the dogs. Interestingly, a few dogs with initially lower than normal clot strength showed a normalization of this parameter after treatment, which is an unexpected finding in dogs with low platelet counts, and further research is needed to understand the clinical significance of viscoelastic testing in predicting bleeding risk in these patients. The study acknowledges several limitations, including the relatively small number of dogs in the treatment group and the variability in the individual treatment plans for their underlying conditions. While immunosuppression is the standard treatment for primary immune thrombocytopenia, the specific medications and the intensity of treatment varied depending on the individual clinician's judgment and the patient's response. The use of a historical control group was a pragmatic approach to increase the number of cases studied at a single center, but it introduces the potential for biases, such as changes in supportive care practices over time. Furthermore, a more objective scoring system for bleeding severity could not be used because the necessary information was not consistently recorded for the historical control group. The assessment of bleeding events relied on documented observations and changes in blood parameters, which might not have captured all instances of bleeding. Finally, while no overt disorders of secondary blood clotting were identified, subtle abnormalities could not be entirely ruled out due to variations in the initial coagulation testing methods. In conclusion, this study found no evidence of widespread excessive clot breakdown in dogs with severe thrombocytopenia and did not demonstrate a survival benefit in dogs treated prophylactically with ε-aminocaproic acid. These findings are consistent with the results of studies in human patients with low platelet counts. Based on the results of this research, the routine preventative use of ε-aminocaproic acid cannot be recommended in dogs with immune thrombocytopenia. However, the administration of ε-aminocaproic acid might still be considered in dogs experiencing severe ongoing bleeding. The researchers suggest that a larger, randomized controlled trial with a concurrent control group would be necessary to definitively determine if antifibrinolytics are beneficial in dogs with immune thrombocytopenia, although their findings suggest that such a study might require a very large number of participants to show a treatment effect. Future research investigating other hemostatic parameters, such as the concentration of plasminogen activator inhibitor 1, might help to identify potential localized imbalances in clot formation and breakdown that could justify the use of antifibrinolytic agents in specific cases. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.